Maybe they can do something.
The crisis in the health system in Uganda has never remained quiet. The heads of the regional referral hospitals in Uganda almost shed tears while lamenting to the members of parliament sitting on the Parliamentary Committee of Health.
ICU, to move a patient who is critically ill from Karamoja is just a nightmare. To Mulago or wherever you can access the ICU bed. So we need affirmative action in terms of infrastructure and other things.
The highway concept of these hospitals. Let's furnish these ICUs, especially Chiradongo and Masaka. We're on two highways. We don't sit separately with this gentleman, not for fun. He is my absorber. He absorbs all my ICU patients I send to Mbarara. Is that okay? So let's look into the issue of ICUs.
As the non-communicable diseases continue to rise, the hospitals and health centers across the country are not ready for the wave.
But Hoima Regional Referral Hospital has an emergency right now. We serve a region that is bigger than our capacity. Because we serve a part of Mubende, geographically patients who are supposed to reach Mubende, Chiboga and Chankwanzi, they flock Hoima. We also have patients who are in the Congo. When you reach Lake Albert,
we don't have houses for our staffs, which is really a big thing. People have gone to the extent of renting as far as Wakiso, Nansan, all those areas, and it makes it very difficult for them to come.
The constant stockouts, no drugs, no gloves, no syringes, and the famous line, go and buy from outside, icks legislators.
And when you find out it is the facility, or either the prescriber or someone related to the prescriber of the medicines, are we really doing justice to our people? So that is the concern that the public is asking. If there are no medicines, we should know there are no medicines. But then what are we doing for that? Can't we have facilities that are having medicines in there?
Everybody here is emphasizing on private wings, private wings, private wings. Now, are we trying to run away from the public hospitals? I am saying, what can we do as administrators or as the head of National Referral Hospital and referral hospitals to cut down the diversion of public equipments into private wings?
What I know is that investigations are being done at a very deep level to find the root cause of that. And I think we should be patient. We should be able to find why this actually happens. There are investigations going on.
Uganda continues to train excellent doctors and nurses, but few are absorbed. Corruption at the District Service Commission has for decades been the order.
You really need to work on that as Parliament. In fact, there was such a WhatsApp which was going around and was saying at least Luengo and Kamwenge were the best districts, because for them, if they take your money and you don't get the job, they return your money. Can you imagine?
The members of Parliament pledged to enhance the health budget on conditions that the authorities consider decentralizing key services like dialysis, cancer treatment, among others. Daniel Mugoya, UBC News.
Very good submissions so far. Then if we ended up